Good evening, everybody, and welcome. Thank you, everyone, for joining us. For those of you that I've not yet had the pleasure to meet, my name is Heather, and I do a lot of work with Antinol, and I'm thrilled to be here tonight. And big thanks to Pacific Veterinary Sales for sponsoring tonight's talk. I see people still signing in, so I know we're going to keep having more people join, but we'll get started in the interest of keeping things on time. So thank you, everyone, for taking the time to join us across many different time zones. Really appreciate you joining after a long day of work for many of you. Those of you who are at home, thank you for taking the time. We're really happy to have you all with us. Absolutely thrilled to have Dr. Huntingford here with us to do a second talk. I'm sure she's very familiar to most, if not all of you on this call, but just a quick bio, to give you a bit of background. Dr. Huntingford is a 1984 graduate of the Ontario Veterinary College, the University of Guelph in Guelph, Ontario. She's certified in chiropractic, acupuncture, rehabilitation, and pain management. She's the owner and medical director of the Essex Animal Hospital, Canine Rehab and Fitness in Essex, Ontario. In 2015, she became a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation, and in 2018, she received her master's in traditional Chinese veterinary medicine. Dr. Huntingford is a consultant for the VIN Rehab Sports Medicine Chronic Pain Board and lectures nationally and internationally on a variety of topics, including rehabilitation, pain management, and geriatric medicine. She has co-authored several textbook chapters and published a number of peer-reviewed manuscripts. And in her spare time, and I always wonder if she actually has any spare time after that list, but she enjoys spending time on her farm and winery with her chef husband, Harold, and her pugs, cats, and horses, and a few adult children. Sounds like an excellent sort of place to escape. So absolutely thrilled to have Dr. Huntingford doing a second presentation with us. There will be an opportunity for questions at the end. We are recording this, so your colleagues who weren't able to make it tonight, we will be able to share it with them. And without any further ado from myself, I'm going to turn things over to Dr. Huntingford.
Thank you so much, Heather. Hopefully people can hear me. I have to make sure I've unmuted myself. Let's see.
I think you just muted yourself. We could hear you.
Yes. Okay, great. Now I'm ready. Okay. So I'm happy all of you could join us today, and I'm very happy to be speaking on rehabilitation of senior pets. I have a huge geriatric clientele. I have a lot of clientele and also of patients, as I'm sure most of you do, because when you do rehab, a lot of these animals that we see are going to be seniors. So just because, you know, everyone should really have an idea of what kind of cases we actually have, I would say that I like to start with a case. So this was an 11-year-old American Eskimo female not spayed whose name was Atari. And I actually saw this dog first on the 21st rather of February. The first picture I took of her was on the 28th. I didn't take one on the 21st because I really didn't think that this dog had a future. She was presented by a rescue as a quadriplegic, and you know, she's not a very nice dog, but apparently she'd had some injury and they wanted us to do some rehabilitation with her. Rescues don't have an awful lot of money. So I said, well, we can try something. I can do an acupuncture treatment on her, and, you know, then we'll go from there. But I don't know that you want to really spend all of the rescue's money on this particular patient. But it so happened that Atari had a guardian angel, and she was sponsored for her rehabilitation. So this is actually 1 week after I saw her. When I originally saw her, she could not get up at all. And now there she was on her chest. So this was her on the 12th. So remember, she was a quadriplegic. She's not moving super well when she's walking just on land, but we put her in our underwater treadmill and she was able to move. And if any of you have seen dogs in the underwater treadmill before, you will know that usually they walk away from you. Well, this particular technician here bonded with this dog and she really wanted to walk towards her. So that was where that was going. So then the 21st of March, this is what she was like. So she's still having a lot of difficulty walking around, but we are able to place her into standing. And these are some of the things that are very easy. Some of the things we do are very easy for everybody to do with these dogs who have neurological disease. So there we're just placing her standing. She's not really walking at this point, but we'll see some other videos of her. And here she is on the 28th of March. And there she is walking like a drunken sailor, but she's walking. And April the 12th, she's walking pretty well. When you think about where she came from, it's pretty amazing. I always said she only really got up and walked around because it was a better way to bite at people. You know, she really wasn't very nice. However, she did bond with my technician, and she of course adopted her. That's, as we all know, what tends to happen. So I think she's doing pretty well there, considering on February 21st, she was paralyzed. So, you know, if people wonder why you want to do physical rehabilitation, why would you want to add something like that to your practice? I think the real reason is not only to help patients that other people may not be able to help, but also, you know, when we think about our careers in veterinary medicine and how much burnout there is. And one of the reasons being because we can't do anything for patients we love, or euthanasias, things like that. And rehab tends to be a very happy place. So the work is very fulfilling. And especially when we're working with geriatrics, which are one of my favorite population group. So I think when we're talking about senior dogs, we need to figure out what are the definitions? What are we looking at? And I mean, you can look at different scales that say, you know, a dachshund is so old at such and such a time. But I like to think of cats being geriatrics when they're over 12, and dogs about 75% of their expected lifespan. So if you expect it to be 10, then 7.5, that patient is considered to be a geriatric. And I like to think of these dogs and cats as being maybe in 3 categories. So I look at old and healthy dogs. So the only changes they really have are age-related changes, or they're old and they have some kind of subclinical organ dysfunction. These are the ones that, you know, you do your wellness panels on and you find that maybe they have an elevated SDMA, they have early kidney disease, maybe they have a little bit of elevation in liver function, something like that. Their ALK phoses are going up. Or we're old with overt disease. We have arthritis and obesity and diabetes and that kind of stuff. So our geriatrics really fall, I think, into one of these 3 categories. And when we look at geriatrics, I think part of the problem in veterinary medicine is that we have ignored muscles a lot. More is being taught about them and learned about them now in veterinary school. But I mean, I went to school ages ago. As you see, I graduated in 1984, and the muscles were the squishy bits that we just moved aside to get to the bones because we wanted to do orthopedic surgery, right? I never wanted to do orthopedic surgery. However, and I always did think, what happens with these muscles? Well, you do nothing, Jan, you just sew them back together. That was kind of the response. But if we think about our age changes in our patients will get muscle atrophy, and in actual fact, they'll get sarcopenia. So what's sarcopenia? That's really a loss of muscle that's due to aging. It's not due to disease, it's due to aging. And so if we look at the Arnie on the left versus the Arnie on the right, these are two pictures of the same guy. And the one is obviously over 60, and the other one was very roided up in the age of around 20 when he was Mr. Universe. So what did Arnie lose? Well, mostly he lost his type 2 muscle fibers, which are going to be the fast twitch muscle fibers, the muscle fibers that we really need for weightlifting, and those kinds of things. And that's what happens when we age. We tend to lose our type 2 muscle fibers. And if you look at the little sentence there, you can figure out that after the age of 40, it's all downhill. And as you approach the tender age of 65, that's going to increase. And I'm not sure that that's maybe not a reason to just have a beer over that. But however, sarcopenia does affect our pets, but we don't really know a lot about this. How does the rate affect what's going on with our pets? We're not super sure, but I can tell you that these two cats are the same cats, and this is a kitty that belonged to a colleague of mine, and Sheila Robertson, and this was her cat at the age of 2 and then at the age of 15. So we can obviously see the differences. The thing about sarcopenia is when we lose our muscle, losing muscle is a predictor of mortality, particularly in dogs, because if you have a dog who loses its back end and loses its mobility, then that's a very difficult thing to deal with for many people. And this is just an interesting little chart to show you the difference between sarcopenia and cachexia. And I have provided my slides to Heather, so anybody who wants to see these lovely things again can certainly get a copy from her. But this is really just showing you that sarcopenia is a natural aging thing, whereas cachexia is losing muscle and losing body condition because of disease. So again, with our aging pets, if they lose the ability to climb the stairs or get onto the bed or posture to eliminate, then a lot of times that means euthanasia. So we have these two pictures of the old dog and then these very young sled dogs who were pulling this sled at the Yukon Quest. I was fortunate enough to go there and up there and do some research with Dr. Joe Wachschlag and the people at Cornell. So what other aging changes do we see? What do we see commonly? Well, obviously it happens in all of the tissues, and I really should put on here, but of course, because I'm a musculoskeletal person, this is mostly elasticity, degenerative joint disease, obesity, that sort of stuff. But to be really fair, we should think about mind things. I like to think of geriatrics as having problems with muscle, mind, and mobility. We're not going to talk about cognitive dysfunction, but it is something that we do see with our geriatrics. And I do some rehabilitation on these geriatrics who have cognitive dysfunction, because if we are able to keep them thinking and moving and playing and interacting, then we can slow down cognitive dysfunction. Same with people. Keep exercising. Anyway, the other thing that we really see a lot with our geriatrics is, of course, obesity. And we know that this is a vicious cycle because obesity is going to lead to osteoarthritis. It's going to cause pain. Pain is going to decrease exercise. And so this is a huge problem. And we know that there's a lot of pets that have this problem with obesity. So our neurological changes that we see with our geriatrics, a lot of these dogs are going to have decline of proprioception and coordination, like this poor old dog. And obviously, they can become ataxic. And what happens with them? Well, it's not just that they become old and ataxic and they're getting arthritis in their spinal cord. They actually have slower nerve conduction, hearing loss, cognitive dysfunction, and of course we see vestibular issues as well. And with our geriatric patients, so what do our owners see? a lot of times they're going to tell us, well, this dog is just, slowing down. He or she is just old. She's sleeping more. She can't really do the stairs. She's kind of confused. And the clients become very worried about quality of life. And this was my old pug, Layla, who really had some fusion and cognitive dysfunction and arthritis. And, my clients would look at that and say, well, this dog's really just getting old. And what do we see? Well, as a veterinarian, we're looking at these dogs, and we're finding painful muscles. We're finding clicking joints, some arthritis, obviously neurological deficits and weakness. And, many of these dogs, as I said, are overweight or they're losing muscle. So it's important not only to body condition score, but also to muscle condition score these animals. And of course, we have gait abnormalities, and we're going to find slow wound healing. So we have all of these. We know what our patients are like. Why are we interested in doing rehabilitation, and what does it do for our patients? Well, as far as the clients who come to see me, what are they looking for? Because when we're doing rehabilitation, we're always talking to the clients about what are your goals? Well, my goal is that this dog's going to be a puppy again. Well, that's not very realistic. But if your goal is that you want the dog to be able to walk, out to get the mail with you, that could be a realistic goal. But what we really think about when we talk to our clients is we talk about quality of life. We talk about pain relief. We want to maximize the quality of life. We want the patient to bond with the owner. A lot of times they want these dogs to be relaxed. And then I'm a rehab person. We have functional goals, right? If the dog has abnormal muscle function, I want to restore it. I want to strengthen if they have muscle atrophy. I'd like these dogs to all be balanced and coordinated. I want to improve joint function and really minimize any kind of contracture at all. And this is one of my patients actually having laser. Interesting patient. We'll see her a little later. So what's the best way to treat geriatrics? Well, I'm an integrative practitioner. I do rehab, but I also have a small animal practice. And even if all you do is rehab, you need to know about pharmaceuticals, because your dogs are going to come in on some kind of pain control usually. And I do feel the best way to treat these geriatrics is to use pharmaceuticals appropriately, and non-pharmaceutical treatments like acupuncture, like herbals, like rehabilitation therapy, things like that are going to give us the best of both worlds. So we're going to talk a little bit about mostly, of course, the non-pharmaceutical things that we're going to look at. So how about geriatric cats? Well, we need to remember that the cat is not a small dog, and it's not a lion. And, when I was in veterinary school, the cats were very much treated like small dogs, but that's not the case now. And if you look at this picture of a cat, I want you to kind of burn that one into your brain. There was a great paper that came out of the University of Montreal that has the Grimace scale for cats. And how do you tell that a cat is painful? By looking at its face. And this is a very painful cat. So if you're interested in that, we could talk, we could have another webinar just on pain in cats. But one of the things, if you're interested in kitty cats, I would encourage you to have a fear-free practice, because these kitties who come to fear-free practices heal better, and they have better immune systems. They're not stressed. So this is just my plug for fear-free certification. And what happens as far as the fear-free stuff? What's the mission? Well, we don't want fear, anxiety, and stress, because it leads to pain. And a lot of these geriatric cats come in and they're painful, and then they're like tigers, and then you kind of have to sedate them and use a little bit of a chill protocol, and lots of tips from the fear-free people on how to handle some of these geriatric cats. So when we look at rehabilitation, we kind of have all these tools in our toolbox, and we're not going to talk about all of them with geriatrics, but we're going to talk a little bit about nutraceuticals and weight loss. And our last webinar was really on nutraceuticals, so we're only going to sort of touch on that. And we're going to talk about modalities, and I'd like to emphasize some of the ones that you can easily do at home. Now, this is a list of my favorite nutraceuticals. The one that you like the best may not be on there. I am a huge fan of Antinol, and I have gone over a lot of the data and the research on it. Very, very strong in the research end. Omega-3 fatty acids, undenatured collagen, that might be one that you may not have heard of, but these are ones that I use. So our green lip mussel, which is our Antinol, it has the omega-3 fatty acids in it. It has EPA, DHA, ETA. There's some chondroitin in it. It's in a freeze-dried form. And Antinol actually has a piece of the green lip mussel, a proprietary molecule that's been taken out and purified. And it tends to work a lot better than just, say, your regular green lip mussel. And what does, this is just a little bit about what does the research say about this? Well, 3 out of 4 papers had great positive results for green lip mussel. And when they had diets that were just fortified with that, because people ask me about that, they not always were effective. And I think probably they were just dosed too low, or they weren't in the right form. And this extract, PCSO 524, that's Antinol, and seems to be a lot more effective. So if we look at these studies, this is a great nutraceutical to use. Love it particularly in cats because it's tiny, and you can usually get them to take it in something, or you can puncture the capsule and squeeze out the 1 or 2 drops that are in there. So it is a great nutraceutical to use for cats. But again, with kitty cats, the best nutraceutical to use is always the one the cat will take, because I wanted a lot of cats to take many things, and Antinol is one that I found that most of them will take, but some of them won't take anything. And so anyhow, there's been a lot of research on this. When I spoke in Asia, this was actually their go-to before NSAIDs, and really opened my eyes at the number of animals who were on Antinol as their first line of defense, if you want to think about that, against osteoarthritis. And so it made me think a little bit that maybe I could reach for this before I reached for an NSAID. And then one of my other favorites is undenatured collagen. It comes from a chicken sternum, and how it works is by developing oral tolerance. So the immune system becomes exposed to these antigens, which is a type 2 collagen that is broken down in the joints. So it's like vaccinating against your immune response to this type of collagen. And I have had personal experience with this particular product, and really I like it as well. And there's lots of research on this. Flexidin is usually the form that we find it in, but you can get it in other forms as well. But there's some great papers on this, and in these papers, it actually worked better than Rimadyl. So I was rather impressed with that. And then this one, we really know, Dasaquin, which is an avocado soy unsaponifiable. And I think probably the boswellia and the curcumin in this are the major players, and as well as the avocado soy unsaponifiable. Not a huge fan of glucosamine. We kind of went into that in our last webinar. Now, this is a poster from the Pet Obesity Prevention people, and this is the newest one that they had, which was, this is their data from 2018, and hopefully they'll be coming out with another one soon. But at that point, like 60% of cats were overweight and 56% of dogs. And it may be more than that after COVID. But this is very interesting. If you read these different things, how do people find out about what to feed their pets? And they're very into this, and they have lots of good information for us. Because I always will tell people, if you can only do one thing for your pet, weight loss, if the pet is overweight, is the thing to do. Because adipose tissue is not an inert fat storage. It is actually an inflammatory driver. So your dogs who have osteoarthritis are going to have worse osteoarthritis if they are overweight. And you can read all of these things that are, released from adipose tissue. None of them are good. Tumor necrosis factor alpha, interleukin-6, all of these sorts of things. So if our pets are fat, there's more of these pro-inflammatory mediators that are driving the osteoarthritis and driving inflammation. And we know that just 6% weight loss is going to improve lameness. So I do recommend that we add nutritional consultations to all of our visits. We chart body condition score, chart muscle condition score, not just say decrease the food, give them a calorie amount. You need a calorie calculation. And I actually have a Excel website that I use, and I'm happy to share it with anybody who wants to email me for it, or I can send it to Heather and she can send it to those who would like to have it. But it basically is resting energy requirement times 0.8, which is going to be less than what's in your nutrition book. But the last nutritional meeting I was at, this is the one the nutritionists are using. So I had my resident make up a spreadsheet for me so I can do these diet calculations very, very quickly. And I don't have to do all the calculations on my calculator. And I just need to know what the food is that I want them to be fed, and also what the food is that they're eating now, and then I can figure it out from there. So resting in 80% of resting energy requirement is going to need what they need for weight loss. So now we can talk about some of the more fun things, and we'll try to highlight things that you can probably do in your practice and that are going to be important for your geriatric patients. And I have a whole list here. This picture, in case you don't know what it is a therapeutic ultrasound. I'm not recommending that you buy a therapeutic ultrasound. It's just an example. And you may have had one used on you when you were at the physical therapist. And I do use mine, but not an awful lot. I use laser way more than this. So cryotherapy, this is something everybody can do. You can do this in any geriatric patient you have. You can do it post-op for acute inflammation. And oftentimes when I give exercises for the geriatric patients, what I will recommend is that they warm them up before they exercise, and after exercise, they ice them so that the joints are not going to be painful. So we want to do that after exercise or before painful modalities. And remember, it's really only fairly superficial. It can feel really good, but it's only fairly superficial. This is a cold compression device that some of you may have heard of, Game Ready. This is a cheap version of Game Ready. So if you do a lot of stifle surgery, it's something that you might want to consider using. But you can just use ice packs and that will work just as well. So you can use hot therapy as well as cold therapy. Remember, don't use thermal therapy within 72 hours of surgery or active bleeding. One place I really use a lot of hot packing with my geriatrics is before I do exercises, because remember, if you hot pack before stretching, you're going to increase the flexibility, the range of motion. So when you heat up your soft tissues, they'll stretch more. It will feel better. The stretch will last longer. The dog will get more out of it. So I'm very much into doing active stretching for most dogs, especially before performance. But most of these geriatrics aren't doing performance. So you want them to do some kind of exercise, heat them up first, and you're much more likely to be successful with doing that. Now, I am a huge fan of laser therapy, and I can tell you this, people ask me, what lasers do you like, yada, yada, yada. Well, all lasers work. All of the ones that you're going to be able to purchase will work. It just depends on the type of therapy that you want to do, how long you have to do it, what you're doing it for, and then it depends on the service that the company is going to give you, what kind of education you're going to get, what's going to happen if your laser's down, who's going to help you. So those are all the things that are, just about buying a laser. But why would I want to use this? Well, it's great for osteoarthritis and muscle spasm. We use it for burns. We use it for wound healing, pain relief, edema, inflammation. And I have to say, don't tell the medical people, but I've used it on myself. I've used it on my family and done some amazing things, with that. So this is Coco. This is one of my favorite old patients. She just turned 20 this week, and she has shoulder pain, and she also has hyperesthesia, and she is on some gabapentin, but she gets regular laser. Great thing. Cats tend to really like stuff like laser and manual therapy, more hands-off sort of stuff. What's something else you can do for your geriatrics or send home with them? Well, I'm a big fan of pulsed electromagnetic field therapy as well. And I like the targeted PEMF. So I do like the Assisi loops. They also have some of these blankets. I'm also a fan of the Respond blankets as well. The reason I like these Assisi loops is I see a number of patients, number of geriatrics that aren't really in my area and then maybe can only come and see me once a month, which, maybe they could have acupuncture once a month. You're going to go in the underwater treadmill once a month, maybe, but that's not going to be hugely helpful. But I can send them home with an Assisi loop and they can treat their dogs and cats at home. And there is evidence, for those of you who like to know about what evidence there is evidence on how well these work. This is just a Prevocox study for arthritis. My friend Lilani Alvarez did a project out of the Animal Medical Center about using this for dogs post hemilaminectomy and how they got the dogs to walk more quickly after that. But I'm really a fan of this because you can send this home with the client. Now, I don't know, what do they cost? 300, 325, something like that. But when you think about it, they're going to get a minimum of 150 treatments. So that is going to be a couple dollars a treatment. It's probably worth it. This is their newest thing. They call this their sleepy pod. So talk about hands-off osteoarthritis therapy for cats. It's really just a soft-sided cat carrier that has 2 Assisi loops in it. So you can get this, the clients can buy this and they can treat their cats at home. So it does work very, very well. So what other things do we do? Well, acupuncture is one thing that I do a lot of in my clinic. It's great for geriatrics. Cats respond better to acupuncture than any species on the planet. And if you do acupuncture, don't be afraid to do cats. And there's a couple types: Western medical acupuncture, traditional Chinese veterinary medical acupuncture. All of them are going to do pain relief, inflammation, great for muscle tension, spasm, obviously osteoarthritis. And then when we're dealing with old cats, cat renal disease, chronic renal failure in cats is an inflammatory condition. So I use acupuncture in that. I will also use it for things like vestibular disease, for LARPAR. So it's something that I do a lot and I have very good success with acupuncture. This is a kitty by the name of Bagheera, and Bagheera was kind of a killer cat when he first came to see me. And when he would come in all the time for his vaccines, he was kind of a killer cat. Well, he unfortunately fell off of a railing of some stairs. So he fell onto his back and he was really, really painful. We did some laser on him, but I really wanted to do acupuncture with him and he responded so well. So this was a kitty cat that had, and he had already had some pre-existing osteoarthritis. It's worked well for him. Kitty cats also like a lot of the soft tissue mobilization or massage. And, people talk about massage and they're like, oh, that's kind of a little airy-fairy, but it isn't. It's going to increase the circulation and, loosen up stiff muscles. If the muscles are the problem, often massage is going to solve the problem, and it can help with muscle atrophy. And a lot of times it's being used for relaxation, but I also use it in my neurological patients, my geriatric neurological patients, especially those who have paresis. We teach the clients how to do this, and it's not hard to learn this. You can do some basic things by taking even some online courses, and you can really, and there's some great videos and stuff. You can teach your clients how to massage their pets, and a lot of times they really like it. Great for bonding with their pets. Now, I'm a rehab person, and so I realize not all of you are. But you know, I have an underwater treadmill. Yeah, I do. And I use that a lot for my geriatrics, obviously for the ones that have osteoarthritis and neurological problems. I also use it for my overweight dogs. I'm going to use it for weight loss and conditioning and dogs who have muscular weakness. And yes, you can put cats in it. This is one of my fat cats who was in for a weight loss program, and his name was Louie. They called him Fat Louie. Was not quite so fat by the end of his program, but you can put cats into the underwater treadmill. Oh, and maybe that's not a video, but let's just go back there. So this was a dog with neurological disease, about a 9 or 10-year-old shepherd, and he had disc surgery done. But as you can see, I have these things called TheraBands on him, and you can use those when they're just walking around. Normally, they don't have to be in the water. They'll help the feet pull forward. But with this dog, we got this guy back walking with our underwater treadmill, all the things we did in TheraBands. People ask me all the time about swimming. You know, is swimming going to be a good thing for my dog? Not fabulous for rehab unless you're rehabbing forelimb stuff. Good for core strengthening. And if you have a pet that has generalized arthritis, it is a non-impact exercise. So that's an important thing to know. You're not going to get the targeted strengthening that you're going to get with your underwater treadmill, but hydrotherapy is always good. And especially for these labs that like to do it, fabulous for, you know, weight loss and cardiovascular things. Now, how about exercises that anybody can recommend? Well, this is my list here. And Cavalettis, which are really just poles like that you're seeing there. All geriatrics, if I teach them only one exercise, that's the one that I have them do. Why? Because it increases flexion and extension. It helps to work on some balance and relieving pain. So I'm often going to put it as like an obstacle course, like I have with this particular patient. The other thing would be weave cones. And, you know, Cavalettis can be broom handles. They can be pool noodles. They can be anything as long as they're a pole that they can, you know, step over. Weave cones, that works very well for balances. You don't have to use a cone. You can use bowling balls. You know, there's many different things that you can use. So Cavalettis, weave cones, and backwards walking are really, really great. The backwards walking helps build up hind leg strength for these geriatrics, and I think that's super important. I do teach things like high fives, and then uneven surfaces. So I have a Bosu as an example. You can use an air mattress. You can use a couch cushion, anything like that that's going to work on balance and proprioception with these guys. Things like cross-legged standing and sidestepping, hill walking. These are all things that you can recommend in your practice with minimal amounts of input as far as financial stuff goes, and also it's easy for the clients to do at home. And you can get some really good books. A lot of the rehab books are going to have some of these therapeutic exercises in them. There's a whole list in the rehab book for technicians. My tech and I wrote the chapter on therapeutic exercises, and we've included some videos with that. So there's lots of cool things that you can look at with that. Also other services where you can get videos on how to do exercises. So what other kind of equipment can you use? Well, Cavalettis, I've talked about, weave poles, and you can get very fancy and you can get balls and fit discs and bones and all of these sorts of things. And none of these are super expensive. If you see the harness this dog is wearing, this is one of my favorite things for geriatrics. And it is because it seems like the geriatric dog has this old geriatric, you know, 80-pound, 80-year-old owner. This is a help them up harness, front end, back end harness for these guys that has been a lifesaver for many of these clients who have dogs that need mobility, need help with mobility. And this, of course, is our cat. So we can do Cavalettis with cats. Again, as I said, they're great for geriatrics. And obviously, we put the bar on the ground for the cat. Here's our little dog that's, whoops, oh, I thought that was a video. Here's our little dog doing weaving. Oh, it is. It just is not. There we go. So we just got these safety cones. You can get them at the dollar store. You can get them at the safety place, but this is just dog following a treat going through this. And they're going to be more challenging if they're closer together. I use a lot of these when I'm assessing. And then these are just different. This is just some exercises here, sidestepping. This is our little dog on our Jog-a-Dog, which is my least favorite thing because you can really only use it for young dogs that need conditioning. And this is a very well-trained dog doing some work on a ball. So there's many different exercises that you can do with your patients and have your patients do at home, depending upon what they're doing and what you want to do. So with kitty cats, they're more challenging, of course, but you want to use carriers, toys, feathers, things like that. You can use boxes for some of their exercise, for some of their obstacle courses, because they can get in and out of boxes. That's something that's going to be helpful. So with cats, you have to really use your imagination because they're only going to do the exercises they want to do. Laser pointers and feathers, of course, very good for these guys and good to get them to do some exercise. And sometimes it's a difficult thing to convince them. One thing we need to remember with all these geriatric patients is that we do have to modify their environment. So we need to think about elevating their dishes, putting down things like carpet runners, rugs, baby gates. That's really not so they'll jump them, so that we keep them from falling downstairs and things like that. And with kitties, litter boxes on different levels. Lots of soft, thick bedding. Remember, these poor things can have elbow arthritis, and these poor old dogs have such a hard time. And of course, ramps if you're getting in and out of the car, and those kinds of things are important. So here's our, this is more of Sheila Robertson's cats, and showing ways that you can get them so they can get into their favorite places. And assistive devices. The Help 'em Up harness I've already talked about. I'll show you another one called a canine mobility anti-knuckling device. It's something that can be used for DM dogs. I tend to use TheraBands and put them to a harness, but you can order this actual product on Amazon, I think. Socks and booties, wheelchairs or something else. Ramps, medical pet shirts. I'm going to show you something cool with that. That's something really cool. So this is our anti-knuckling device, but you see it's really just a harness, and you can buy this thing for about $300 on Amazon, but you could just make it yourself. Just put a harness and tie a couple TheraBands, which are worth about $2 on there, and that would be helpful. I do sell some booties, but PetSmart has a number of them. And the wheelchairs, we like to fit wheelchairs for our clients, and then they order them themselves. We know how to fit them, so we will do the measurements, we'll help them, and they send them away. And then what we do is that we go on and we have them pay for them. So this is a very interesting case. This is an old dachshund, and I just wanted to show you the value of a medical pet shirt. So this is what this little dog looked like. You can see he's kind of ataxic, wobbling around, typical hunch, and not walking very well at all. So there is an acupuncture T-touch theory about connecting the back of the dog and the front of the dog. So you can do that by putting a medical pet shirt on the dog, this is all we did with this dog on this day. I didn't treat him other than put this tight medical pet shirt. These are the shirts that you can use instead of using cones for your dogs post-surgically. So anybody can do this, and you could look like a hero putting this on, because suddenly this dog can walk better. It just helps connect the front of the dog to the back. So this I thought was a pretty cool thing. So I wanted to finish up a little bit here. Heather told me, maybe only go an hour. Include, you want to leave some time for questions. Of course, I'm happy to do that. But I have some common geriatric cases that I think you might be interested to see. I was always interested in seeing cases. So this is one of my patients. This is Boomer. Boomer is a 9-year-old male neutered Labrador retriever, and he was a retired hunt test dog, and body condition score 7 out of 9. So he's at least 20% overweight, and he kind of was retired. And so we had gradual lameness. He retired from the hunt. He couldn't really go up and down the stairs very well. So he was given Rimadyl, but that caused some GI upset, and the owner was worried because the dog had pain and lethargy. So we did an exam on him. We radiographed him. This was Boomer's hips, and it's amazing that he didn't have problems before this. Obviously, what we found was decreased hip extension bilaterally. He had a lot of pain. He was overweight, obviously, and his iliopsoas muscles were very painful. If you're not familiar with the iliopsoas, it is a muscle that runs from underneath the lumbar vertebrae and attaches down on the lesser trochanter of the femur, and it is frequently a problem with pain and dysfunction and can cause lameness in the hind end. But oftentimes these dogs who have hip issues or knee issues or SI issues or LS issues will have iliopsoas pain. And obviously he was bunny hopping and doing all the things that we see these dogs do. So what did we do with him? Well, we wanted to do some multimodal therapy with him. So we did a bunch of things that I've already talked about. We did some acupuncture with him. We did some exercises. He really liked swimming. We did underwater treadmill at first, and then, we did some swimming with him. We got weight off of him, which was a big thing. And I also did some platelet-rich plasma injections into his hips. And of course, we added Antinol and Cartrophin, and we did all kinds of things with this guy. And he did very well. I actually just put him to sleep last year at, I think he was 14 at that point. So here's something else. This is a kitty cat, because we better talk a little bit about these geriatric kitties. This was a cat that had renal failure and a little bit of chronic renal failure, and it had back pain. The cat did not like her back touched. She didn't want to jump. Irish stage 2 renal failure. She was not good at taking medication, not good at all. And she had some arthritis in her thoracic and lumbar spine. And here, this is Naomi. So here she is having a little bit of acupuncture, and that's going to help out her back. And it's also going to help out her kidneys. We did some laser on her. She would take Antinol if we mixed it in with her food. She would not take it as a pill. And she, she's still with us. Naomi belongs to one of my technicians, actually, and is doing very well, still taking her Antinol, still getting her acupuncture. And then, we do a lot of paralysis and paresis cases. This is just to remind you what happens when we have neurological deficits. The first thing that we're going to find with our geriatric patients is usually proprioceptive deficits. And then it's going to go on to some ataxia, plegia, and on it goes. So one of the big things that I wanted to talk to you about with these geriatric neurological patients is retraining motor patterns. So this sort of thing came from stroke victim recovery. So they wanted to do, they're mimicking normal motor patterns, and particularly important with the quadrupeds, because the generators for motion in the quadruped exist throughout the spine. So you can wake them up. You don't necessarily need the brain to be engaged. You can wake up some of these sort of things. And retraining motor patterns using manual therapy. We call them PNF patterns, therapeutic exercises. So these things are very, very good. Whoops, that's a very noisy thing. So that's really what we're doing here. We're getting this dog to walk. We're retraining his motor patterns. And that's also what we're doing here. So if they don't actually walk, we walk for them. There she's playing with the tail. That's something that we can do. But doing motor patterns and walking for the dogs is something very, very important. And you don't have to do it in the water. You can do it on a land treadmill. You need a couple of people to do that. But this is what you're doing. You're doing motor patterns for this dog. And by doing that, you're putting neuro input into the spinal cord and you're asking it to recover. And when you do, this is another one that you can do as well. This is just an assisted standing. So she's going to get the dog to stand up. She's going to help to support it. But if he's actually trying to stand on his own, that's going to give us input in through the mechanoreceptors, the Golgi tendon organs in the feet. So it's going to be helpful for that. There we go. So a couple other quick tips for stimulating your neurological patients. You can get a small vibrator like an electric toothbrush, something like that, and that can stimulate your weak muscles, tapping the muscle bellies, and then doing postural reflexes, maybe wheelbarrowing, hopping, things like that are going to be very, very useful. The tensor we already talked about. Anything that you can do to sensory stimulate any of these old geriatric patients, that's going to be helpful. And again, we need to remember about lifestyle and doing passive range of motion. As I said, with these guys, you can heat them up and then you can move the joints. And neurological patients can suffer from contractures. You want to stop that. And you want to do passive range of motion. That's something everybody can really do in their practice. Wanted to talk just a teeny bit about degenerative myelopathy, because these are patients that you will see. These are going to be your geriatric patients. And there was just a paper that was written by Lisa Miller and Debbie Sriracha that was published on using high-dose laser for dogs who have degenerative myelopathy. What we know about degenerative myelopathy is that after diagnosis, these dogs are going to be around for a mean of 55 days. But if you do physical therapy with them, 255. So this is a good reason to consider doing that in these dogs. This dog's was one of the old DM patients that we had. I'm sure everybody has seen these guys, that's for sure. And the treatment goals for these guys are really, maintain life and quality of life for as long as possible. That just tells you what it is that the laser therapy does. And I'm not sure that it's really doing an awful lot to the spine, but I think it's helping some of the muscles as these muscles get very, very fatigued. So I think it helps slow degeneration within the muscles rather than really within the nerves. But this is the paper, and it's very interesting to read their results. And this was basically the dosage. This is showing you with using thermal imaging, what the secondary and tertiary compensatory muscles look like before and after. So before, red is bad and green is good. So you can see there's a lot less red on the right side. And a few other therapies, for DM. Obviously, we're using acupuncture, but assisted devices and intense physiotherapy. If you have a patient and you're wondering what to do with it, and you can always shoot me an email, and I'm very happy to talk to you about some of these DM patients, and also our geriatric onset laryngeal paralysis patients as well. These would be ones that you're going to see. Now, as we know, they start with the laryngeal paralysis, and they can have megaesophagus, that kind of thing, and they're unsteady. And they will go from having the laryngeal paralysis to having the weak muscles and the polyneuropathy. And so conventional therapy, you're looking at doxepin and maybe surgery, but a lot of these dogs don't do well with surgery. So what do we do with rehab? Weight management, decreasing activity, acupuncture, and the physical therapy. With these, we can really help these patients. This is actually a dog here. This is a very interesting dog, and I realize it's not a geriatric, but this was a dog that I sent to see a specialist because it had laryngeal paralysis at the age of 2. And they said, okay, well, we're going to need to do surgery on this dog, but we can't do it for 6 weeks. So I did acupuncture on it in the meantime. When it went back to have its surgery, the surgeon said, well, this has actually improved like 95%. And we had done 4 or 5 treatments of acupuncture. And this dog has done very, very well with this. So I think that was a whirlwind uh, of different things that you can do with your geriatric patients. And so Heather, I'm not sure how you want to handle the questions. Do you want to give me the questions? Do you want me to read them in the chat? What would you like to do?
Well, first of all, thank you. Fantastic presentation. And I just seriously love this photo so much. So I hope you keep using it at the end of every presentation.
This is my dog, Allie.
It's so cute. We've got a couple questions that came in by the chat. One question was, do you recommend Antinol versus green lip mussel straight from New Zealand? I have my own opinions on that, but I don't think my opinions are what they're after.
Right. I think that the research has been done on the Antinol, and I know that the formulation of the green lip mussel is very, very important. And from what I have read, that the proprietary blend of the extract that is Antinol is actually more effective. And I think that it is, because before Antinol was available, I used to use Sasha's Blend and a few of the other green lip mussel products, and I did not have the results that I get with Antinol.
And just to add in that Antinol is also sourced from New Zealand, so it is
yes, it does come from New Zealand.
Very similar pure sources, but yes, I would wholeheartily agree. So another question that came in: any insight on PEMF therapy on DM patients?
I'm sorry, was that do we do PEMF therapy on DM patients?
Yes, I think just looking for general feedback.
Yes. So I do a lot of targeted PEMF for many things. And yes, if you have a DM patient, is it a good idea to put in a CC loop on it? Well, I think so. It's going to be helpful because it's going to help the muscles for sure. But I don't believe that the CC people have done any research on using PEMF and, specifically for DM, but I certainly have used it a lot for other neurological patients. So it's going to be helpful.
Fantastic. And then we had a question about asking if you can explain cross-legged standing.
Yes. So cross-legged standing is, consider that the dog is just standing there normally. If you want to use cross-legged standing, if you're trying to work on core strength or proprioception. So if any of you if you do any yoga, any Pilates, if you work out at the gym and do what they call bird dogs, then you understand what cross-legged standing is. So think of the dog as standing there. You pick up the right front leg and the left hind leg. So that's a cross diagonal legged standing. So the dog is bearing all of its weight on the left front and the right hind. But it's the same as if you're doing it on your knees and you put one arm out and one foot out, and like a bird dog.
Thank you. Question: other than underwater treadmill, walking backwards, are there any other exercises you recommend to increase hind end muscle?
Yeah, there's actually tons of exercises you can do to increase the hind end muscle. There is one that is called a get up exercise, where you have the dog in sitting position, you pick up one of its front legs and ask it to stand up. So then it's going to have to stand up using just its back legs. If you live where there are hills, zigzag hill walking is fabulous for back legs. And with that, I mean, you're going back and forth across, not straight up and down. It's, you're zigzagging up and back and forth. That's going to be a good thing. Anytime that you can have elevation changes, that's going to be great for the back legs. You have to be sometimes creative with some of these dogs because they may not want, to do things. if you have a dog who really has very, very weak back legs, then putting them over a ball and sort of doing some dancing back and forth is going to be, is going to be helpful. Doing ladders that are on the ground, those sorts of things. So there's a lot of different ones that you can do depending upon the disability that your dog has. I usually like your backwards walking and your geriatric and the Cavalettis for the geriatrics, because usually they can do those.
Perfect. And the last written question is, do you recommend using omegas if you're already using Antinol?
So, that's a very interesting question. I asked my friend Joe Watchleg, the nutritionist, about that. And he said to me, well, it just depends on how much money you have, because they are synergistic. You can use them together. They don't interfere with each other. And there is some value for using both together. I guess the question is just, is it, how much better do you get if you're adding omega-3s and the green lip muscle product? But I mean, I will do that. And I have found that you do get, in this case, more is actually better. But if the client wants to pick one or the other, they certainly can do that.
Perfect. Thank you. Are there any other questions that we haven't gotten a chance to answer? And of course, please feel free to send questions into myself after, and I'll communicate with Dr. Huntingford. I know a lot of people wanted your spreadsheet, so I'll get that sent out to everybody. Great. Well, it looks like we'll leave it there for tonight, and dead on time. That's very impressive. It's a well-planned talk you put together. Thank you once again. I thoroughly enjoyed that, and I can see from all the questions that it was very interesting for everybody. So thank you so much for the time and sharing your knowledge with us tonight.
I'm happy to do it. And, thank you very much for sponsoring the talk. I'm always happy to talk about geriatrics, one of my favorite topics.